time we talked about your balls, because ignoring them could cost you. Let's be honest, it's not something most men talk about, but in this episode of Man Alive, we'll dive into testicular health to equip you with the information you need to actually look after them. I'm Dr. Jeff Foster, an NHS and private GP specialising in men's health, and today I'll be answering the 10 most commonly asked questions about testicles. So let's dive in. Number 1, is it normal for one testicle to be bigger than the other? Yes, it is definitely normal. And not only do we tend not to develop entirely symmetrically as humans, I mean, obviously your arms and legs are basically the same, but when it comes to organs that are paired, often we find that one is slightly larger than the other, but there's also a practical advantage in having one testicle larger than the other. And that leads on to the second question. Number 2, why does one testicle hang lower than the other? If you think about your scrotum and you have 2 testicles in the middle, and you imagine them a little bit like a Newton's cradle. So for those not watching this, I'm just going to hold up 2 satsumas as the example. But if you have 2 spheres or balls that are touching the same size, every time you walk, they're going to bang against each other. If you swing left, if you swing right, they're going to hit each other, and you'll start to have some quite uncomfortable testicular collisions. And we don't want that. So by having one higher than the other, and often by having one lower than the other, that sits them in the little sac in a much more comfortable way, which means that you can mobilize and walk around more easily. Humans are really weird in that we have evolved in a really odd way to have some of our most delicate and susceptible areas to injury on our biggest and exposed area. If you ever wanted to imagine that evolution hasn't done its final job with us, or that there is a true grand design of what a human should look like, we as men, certainly, not so much about women, but men are definitely not it. Because if you were going to design a powerful, strong warrior, the last thing you would want to do is put the 2 most important bits to passing on your genes in a loose bag at the front in between both legs, where all you have to do is run up and hit someone there and they go down straight away. This is because we haven't really evolved very well still to be up on 2 legs. So our scrotum and our testicles and our future DNA is not particularly well protected, which is crazy, really. But it explains why, from an evolutionary perspective, we haven't really mastered this yet. Some animals, things like rhinoceroses and elephants, do have internal testicles, and that can protect them. Obviously, it gives a safety value. But from a human perspective, and like many other primates, our testicles are on the outside, and that's because of temperature. If you want to maximize your testosterone, but more importantly, your sperm production, you actually want your testicles about 3 degrees lower than the internal temperature of your body. So you actually want them about 34 degrees. And that's why you want your testicles on the outside so that you can maximize your sperm production. And that's also why our Achilles heel is where your Achilles is. So it's not that. If you're enjoying the podcast, would you mind following the show on whatever platform you use and giving us a 5-star rating? Thanks so much. Question 3, how often and how should I check my testicles? So this is a really interesting question because the history of testicular examination actually comes from no medical basis whatsoever. The history of testicular examination comes from a pro-army promotion effect to try and get people to be men's health aware from the sort of 60s, 70s in America, where they thought if they got men to self-examine their testicles, it could promote ideas around men's health. And it was all driven through the army. I'm not sure why, but there was no medical evidence to suggest this was a good thing to do, which is crazy, really. But it's actually become so well accepted that this is what we do. And sometimes interesting things in medicine come back retrospectively. And though this was something born out of no medical credibility whatsoever, it actually works really well. So we tend to tell men you should examine once a month. And what you're examining for is, if I use the satsuma analogy again, you've got 2 satsumas, which would be 2 testicles on your left and right. What you really want to feel is a smooth and slightly uncomfortable feeling when you squeeze and touch your testicles. A normal testicle, like we said before, will be bigger in one different position than the other. And what you're trying to feel is a soft and slightly squidgy sensation as you work from top to bottom. It doesn't really matter how you examine your testicle, as long as you have a methodical approach to make sure that all the testicle is covered. So what we tend to say to patients is have a shower or bath first so that your scrotal sac is warmer, and then everything relaxes a little bit so you can get to it better. Use one hand to steady the testicle and use the other. I'm just going to put one testicle down, or satsuma. Hold the testicle and then just work your way around it top to bottom, feeling for any lumps. Now, if you feel an abnormal lump, the first thing is do not panic, because actually testicular lumps are really common. But what we're looking for specifically in testicular cancer is more something that feels gravelly or pea-like. And the difference with a testicular cancer lump is that you can't separate it from the testicle itself. Scrotal cysts, other things that you find that can form non-cancerous lumps, usually cysticky in some nature, are often quite mobile, and you can kind of move them all around your testicle, which is instantly more reassuring. But even with that, the key is if it feels gravelly or it's new, then we want to get it checked out. Around the testicle itself, so you go top to bottom, feel the way around, and then you work around that. You've then got the epididymis, which is where the sperm are then transported to, which then go off to the seminiferous tubules, which then work their way out. Then you then get rid of your sperm when you have sex. This is not related to your testosterone. Your testosterone is related to your artery and your blood vessel in your testicles, and not related to the tubes that you feel around it. That is just carrying the sperm and nothing else. The key with testicular lumps is that ideally we get you to feel once a month. You've got to remember that testicular cancer is incredibly rare, but scrotal cysts and other types of lumps and bumps in the testicle are actually incredibly common. So we would always say that if you feel a lump, you should definitely get it checked, but the odds of it being cancer are still extremely low. And that's why you shouldn't put it off, because the whole point around testicular cancer is that if you catch it early, it's entirely treatable. And 98% of men who are diagnosed with testicular cancer will have at least a 10-year survival rate. So it's really good. The key is just don't ignore it. Question 4, what does a lump on the testicle actually mean? Well, I've kind of covered that a little bit. But as I say, the actual types of lumps you can get around the testicle are really quite numerous. And they can be anything from what we call a varicocele, which is a large vein or a bag of worms sort of sensation, which is basically varicose veins at the top part of your testicle. They can be types of cysts that you see in either the epididymis or around the testicle itself. They can be within the scrotum, and they can be due to buildups of sperm, or they can just be normal cystic tissue that forms. You can get hernias, and a bad hernia will actually go all the way down into your scrotum, which you think you'd know about. But again, sometimes we just don't think about these sort of things. And you can even get fluid buildup, which is called a hydrocele, where the bag of fluid in your scrotum just gets larger and it feels like it's a lump, but it's just fluid that's building up. And that's why, because there's so many things that could be a lump, but they don't have to be testicular cancer, that's why it's so important really just to get it checked. Because those that say you shouldn't have an examination for your testicles will say it promotes unnecessary anxiety, that it's going to worry men, that they're going to come in with lumps that aren't cancer. And yeah, I totally get that. And there was actually an article in one of the well-renowned medical journals in the UK that said, well, we should not be promoting male self-examination because of the anxiety it causes, because testicular cancer is so rare. But actually, wouldn't you rather have a scan and be told everything's okay than go, actually, I'm not going to bother checking, and then it turned out it was something sinister that you could have treated? So I would say I would rather have 99% of men be slightly anxious but get a scan and it's all okay, than say do nothing and miss out the chance of treating someone that we could have saved because they were told not to examine their testicles. Number 5, what are the signs and symptoms of testicular cancer? So testicular cancer will usually present in 2 ways, or one of 2 ways. The most common ways it presents are either as a lump within the testicle, and we said that usually feels like gravel or a pea that's sort of stuck to the testicle itself, so it shouldn't move around because it's stuck to the testicle mass itself. Interestingly, I've never seen a case of cancer relating to the epididymis or the tubes outside of the testicle. I assume it could theoretically exist, but I've just never seen it happen. So it must be incredibly rare. And testicular cancer itself is also rare, which means the other one's got to be even more rare. So what you're looking for is a lump that's gravelly or hard stuck to the testicle. The other presentation that some men will get will be pain or discomfort. They may feel the testicle and it may feel uncomfortable when they examine it. They may not feel a lump, but they might just feel the testicle itself and it hurts. Now, the problem with that is most of the time, again, it's not actually testicular cancer. It could be orchitis, which is an infection of the testicle, or inflammation, and there's various other causes that are not cancerous, but the key is you still want to get it checked. The final reason that you might think you might have testicular cancer is what we call hematospermia, and that's blood in your sperm. Now, that's actually pretty rare. Under the age of 40, we say that you're allowed to have 3 episodes of blood in your semen before you would have to go get it scanned, because the leading causes in younger men actually is trauma, so that you've been doing something enjoyable, perhaps, with your spare time, and you have inadvertently gone a bit too over the top and hit your testicles against something, and then that can cause a small amount of bleeding, which you then see when you ejaculate. And that could last for 1 or 2 more times when you ejaculate and clear it. And that's fine. The other reason is you could be doing sport and that could cause damage or injury to your testicular sac, as we talked before, because unfortunately your testicles are on the outside, so very susceptible to injury. If it's more than 3 times under 40, or if it's once after 40, you should still see a doctor and you're probably going to need a scan because you want to make sure it's safe. And again, it's still rare. It's the 17th most common cancer in men. So it's not a common cancer. But the key is if you don't get it checked, you don't know. Number 6, how do testicles affect fertility, hormones, and testosterone production? Without testicles, you will not have fertility, testosterone, or any male sex hormones. So pretty much you need them for all of this stuff. There's some really interesting historical data about what happens when men don't have testicles. And probably the easiest way to think about this is looking at boys pre and post puberty. If you never knew what your balls did, then just seeing what changes occur in a boy between the ages of 10 and 20 is enough to work out what testosterone does, because you can see this enormous change. And everything your testicles do is designed to take you from that side of being immature and unable to procreate to being in a position where you are physically strong enough and mentally mature enough, although obviously we'll say guys were not mentally that mature in their late teens, early 20s, but technically could then procreate and then father a child and further the species. Interestingly, different mammals will progress their degree of testicular maturity at different stages. And for humans, we're pretty late. It takes us ages to reach a point of puberty. This is like 11, 12 years before we start to see changes in our hormone levels. For things like cats or dogs, it's a few months, and then they're technically ready to reproduce. And you could argue that if we got humans and said, well, if we got humans to procreate, or they were able to effectively spark their puberty and their testicles became active at the age of, I don't know, 3 or 4, then technically you could have kids by 5 or 6. But excusing the horrific concept of what that actually means, the reason we don't do that as humans is because we aren't mentally or physically mature enough to reach that point. So your body deliberately delays the amount of time it's going to wait for puberty to kick in, because humans of evolution has realized that kind of like your brain is not mature enough to know what to do. You probably could have evolved quicker, and we could be like other mammals that evolve much more quickly, and then you could be puberty aware within a couple of months, but our brains are too big and that slows us down, which means really you don't want to be hitting puberty to your mid-teens. The other thing about testicles, of course, is that if we have historical data around eunuchs and castration, we know that not only can you not father a child if you don't have testicles, but you're not going to go through puberty. Eunuchs were a really weird thing where, for some particular reason, people would be castrated either out of choice or by torture or some other cultural reason, which would mean they would have their testicles removed, usually before puberty. And these people would not develop in the same way to reach adult manhood that a person with normal testicular function would. And actually, in terms of some of the Chinese dynasties, that was still present, and we still had eunuchs up until the 20th century, which is crazy when you think about it, but you can really see what happens to these people. And in some genetic cases, there are some also medical conditions, such as Klinefelter's disease, for example, or what we call cryptorchidism, where you don't develop your testicles properly, and then you can see what happens to people when they just have not got enough testosterone. Final bit I might just mention around fertility and testosterone is actually you do need both together. So you can take someone's testosterone away and you think, well, can you still produce sperm if you've got testicles? But actually, your testicular cells, Sertoli cells and Leydig cells that make testosterone and make sperm, are very closely linked to each other. And you need testosterone to make the Sertoli cells also activate to make sperm. You can't cut one out without the other. So you can't have someone who's completely testosterone lost but still have normal sperm functioning. So there is a really close link between the two. Have a suggestion for a Man Alive episode, or thought about something said in this episode? Comment below and I read every one. Question 7. Does testicular size matter for health, and is size linked to masculinity or performance? Absolutely not. If you had very large testicles as a guy, you might imagine that therefore you must be really super fertile because your balls are so big that you must produce all this sperm. But the average adult male produces about 200 million sperm a day. I don't know how many you think you might need, or how many children you want to have, but 200 million is probably quite a lot. And even if you said that less than 5% of these are actually going to be half decent quality, and I don't know what the percentage is, but it's going to be very small. Even if you said 1% of those, it's still going to be more kids than you're ever going to want to have. So having larger balls doesn't necessarily confer a greater degree of fertility. It just means you have larger balls. There is a critical size, and if your testicles are too small, then there will be a drop in function. So we know that people with certain medical conditions or genetic conditions won't develop their testicles properly. And we also know, again, puberty to post-puberty or pre-puberty to post-puberty, that the testicles in younger boys are smaller and not truly developed, which is why you do have to have a critical point where they'll be starting to function. So I would say whether they're normal or slightly smaller than normal, or where they're much larger, you're still going to get sperm out of it. And it doesn't even mean you're going to get more testosterone. So absolutely does not matter. You shouldn't be having to worry about testicle size comparisons with your friends or colleagues. It's your time to do. It's absolutely fine, whatever you want to do in your own time, but it doesn't link to testicular function or your ability to be more masculine or performance or father a child. Question 8. What are common causes of testicular pain and how to tell benign versus serious? Testicular discomfort is really common. From a very early age, most boys become very aware that they have testicles and external testicles. And I don't know how many times you see this, but you often see young baby boys who will be automatically clutching and moving around at their own scrotum. And that's very normal. Men become very aware of their testicles from an early age, and that continues through their entire life. It's very common for adult men to be told by their partners to start rummaging down below because it's socially unacceptable. But actually, it's still a common thing for guys to always be thinking, even if it's subconsciously, about their manhood and testicles. So the reason it's interesting is because we then often get altered feelings or sensations around our testicles because it is a hypersensitive area. Now, that doesn't mean it's necessarily a bad thing, but we do feel our testicle, we feel the sensation of our scrotum a lot. If you ever, for example, notice that when you wear clothes, you don't feel the clothes you're wearing after a couple of minutes, you do get the same effect with your testicles. However, due to the fact that the scrotum moves around a lot within your pants, you often find that you then get an awareness of your testicles again. That doesn't mean it's a bad thing, but you do often have to move things around a bit for comfort. In terms of testicular pain, generally going to come for a couple of reasons. Either you get testicular pain because of some sort of anatomical or mechanical injury. So it could be torsion, which is twisting of a testicle, which is extremely painful and supposed to be the most painful experience you can get as a guy. That tends to occur in the early teens, maybe ages sort of 9 to 14 is the most common presenting complaint. It's not common as an adult. It's not impossible, but much, much rarer. You can get infections of the testicles. So again, we can have orchitis, which is an infection of the testicle, epididymoorchitis, which is an infection around the tubes around the side. And these can be caused by infections. You could be run down. You could have an infection of the prostate. You might have a sexually transmitted disease, and that can go to the testicle and can affect you as well. Chlamydia, gonorrhea, they can all cause these sort of things. And you can also have other causes that cause pain. And one of them, of course, is testicular cancer, but it's not a common cause of testicular pain. Other things that can cause it are things outside of the testicle itself. So testicular pain can be caused by referred pain from above. So for example, if you have a hernia that's higher up in your groin, it comes down to the testicle, causes discomfort. And sometimes in younger men in particular, we often say this in boys, if you have abdominal pain, you should always check the testicles as well, because that can cause pain and the problems coming from up here or down below and vice versa. The reason why it hurts in your stomach when you get kicked in the groin is because of the embryological origin of your testicles. So in the embryo, in the womb, your testicles are up here, and I'm pointing sort of more where my kidneys are. And then over a couple of months, these testicles descend until they eventually go outside into the scrotal sac. That's the reason why the nerve origin still sits up in your stomach, hence why you always feel sick when you get hit in the groin, which is quite weird. But it's also a reason why we have to differentiate between the two when people present with groin pain or stomach pain, because we don't always know where it's coming from. I guess the other thing to think about testicular pain is it could be things like urinary tract infections or prostate disease, but generally these don't present in the testicles because it's a separate system. And it is really important to remember that your bladder and your kidneys are not connected to your testicles in any direct way. Question 9. Can wearing tight underwear, hot tubs, high temperature, and phone usage affect testicle health and sperm? Absolutely yes. It's a really weird scenario, but a lot of the things we do as guys, certainly now in the 21st century, don't help our fertility and they don't help our testosterone and in particular our sperm. So as I mentioned earlier, you want your testicles to be about 3 degrees lower than the rest of your body temperature. And if you're sitting in very tight pants, lying around in a hot tub with a temperature and putting your phone by your groin, then that's all going to rise or cause a rise in that temperature around your scrotum, and the efficiency of those organs are going to go down. Now, that doesn't mean you therefore have permission to walk around with your pants down because the doctor said it's better for my sperm. But we do say to people, if you're trying to conceive, then maybe taking hot saunas or hot baths or wearing tight pants is not a good thing. And we probably shouldn't be keeping our phone in our front pocket anyway, because the warmth effect could have a negative impact on your testicular function. I've even seen one patient who used to do a lot of work with his laptop, and he just had it on his lap, always typing away, and that did cause a reduction in his fertility. So we have to think about things that are warm that will impact on our testicular function, because cumulatively it really does make an effect. We've got to remember that fertility in men is dropping decade on decade, and there are lots and lots of causes for this. And I appreciate this isn't necessarily the time to go through all of those, but one of those is how we look after our scrotum and our testicles. And if we compare how our lifestyles are compared with 50, 100 years ago, we do things to our own manhood and masculinity that are not healthy for our testicles. Question 10, what lifestyle habits help keep testicles healthy? Testicular cancer is a cancer that you can't really do much about. So when we talk about things like prostate cancer or bowel cancer or lung cancer, we know that there are lifestyle factors that will increase your risk of having the disease. So for example, we know that smoking increases your prostate cancer risk, lots of alcohol, being overweight, they all increase your risk of prostate cancer, having a sedentary lifestyle, all the common things we talk about. Interestingly, none of those affect your testicular cancer risk. The only things that really affect your risk of testicular cancer are having a family history of it, which you can't do anything about. If you had an undescended testicle at birth and you had to have an operation to bring it down, that increases your risk, but you can't do anything about that either. Or if you're white, and if you're Caucasian, you have a higher risk, which is quite unusual as well, because when you look at things like prostate cancer, it tends to be the reverse, where Afro-Caribbean men have a higher risk of prostate cancer, but less of a risk of testicular cancer. But again, your ethnicity, you can't do anything about either. So you can't do anything generally to remove or reduce your risk in terms of lifestyle habits to reduce your risk of testicular cancer, except regularly check them. And that's why it really is so important. And you don't have to be really good at it. And there isn't some special technique to make sure I've really picked out every little bit. The key is you just do it regularly, once a month in the shower, make sure things are warm and just feel top to bottom. And if you feel a lump, don't freak out. You just go to your doctor, they'll do a scan, and remember that like 99% of the time, it's not going to be cancer. A few other things you can do probably just to keep your testicles healthy. Don't wear tight pants all the time. Give them a rest. At night time, do you really need to have pants on in bed? Do you need to have pajamas on in bed? I mean, this might be an issue with your partner, I don't know. But you're then looking at a time to try and maintain coolness and less stress around the area. We do talk about things like whether long-term cycling can impact on your prostate and potentially your testicles as well, because you're putting a lot of heat and friction over the saddle area onto your testicles, and that can have a negative adverse effect. So things in moderation. I don't want to stop people cycling because it's really good from a health benefit, but maybe just too much of it might be seen as a bad thing. And then just think about temperature. Keep your phone out of the way. Don't sit in a hot bath for too long. If you're going to use a sauna, do it short term, because there are lots of other things. And we need to be realistic in life about things you enjoy. You might really like having a bath over a shower. That's fine. But everything in moderation, and look at those other risk factors that you can do to try and maintain your health. The only other thing I would say around testicular health is probably not to be too overweight, because whilst being overweight will have other adverse effects, it doesn't directly affect your testicles, but it will affect your testosterone and it will affect your fertility as a consequence. So leading a healthier lifestyle, so not smoking, not drinking too much, getting good night's sleep, exercising, and all the things we tell you to do for general health normally will help your fertility, but not necessarily your testicles. And I appreciate that's kind of the same, but not the same thing. In terms of supplements, things you might want to take, well, for fertility, again, they say that taking certain male supplements like zinc and selenium can help improve the quality of sperm, but not necessarily the volume or health of your overall testicle. And that's why we're talking about slightly different things. The general process is if you eat well and do all the sort of lifestyle things that I mentioned, then your testicles should be pretty much fine. There we have it. And yes, consider this your permission to check yourself regularly, purely for medical reasons, of course. Thanks for listening to this episode of Man Alive. Make sure you're following the show wherever you're listening or watching, and we'll see you next time. If you enjoyed this episode of Man Alive, you would love this one. Go on, press it. Click now. Press it now.